So teething. Teething is a major concern, especially with first-time mothers. And remember we said the teeth grow at 6 months? Okay. So at 6 months, and when your child is very close to teething, so talking about a 5-month-old baby, okay, how will you know that the child is teething? What are the signs that you look for? The first thing is that these children want to bite anything. Okay, you find them putting fingers in the mouth, toys, anything that they want. And the reason is because they usually have some irritation on the gums. Okay. The next thing you'll find is that the children usually drool a lot. You find them really drooling, and they have reduced appetite. Some parents will say they have some fever and diarrhea. And the reason for the fever and the diarrhea is actually because they tend to introduce a lot of unclean stuff in their mouth to just sort of relieve the pain. The other things that the child become very irritable at night. They don't want to sleep. They wake up early. The child is fussy. So those are the signs that you see in the teething, the child that's going through teething. So how do you relieve that? One way is to actually just massage the gums. Just clean your hands, okay, and just massage the gums slowly, okay? It kind of soothes the child. The other way you could do it is that you can peel a carrot, okay? A very big carrot, not a small one, because you don't want the child to break it, and then there's a risk of choking from the carrot. Just peel a carrot, and then have the child just play with the carrot and bite on it. It really helps them. It soothes the irritation and from the gums. Yes, there are also teething gels that are sold in supermarkets, in pharmacies, and they really work. You just need to massage on the tooth, on the gum pad where the tooth is growing. But all in all, just make sure you massage the child, keep the child safe, because they'll want to put all sorts of objects into the mouth, and some of them, they have the risk of choking. But it's a normal phase of growing. Yes, and it's not something to be very alarmed about. Yes.
The types of food to avoid and what to...
Okay. Mm-hmm. So, what types of food should you avoid when you're for your children? Now, the thing is, we said that you need to maintain these teeth and have them come out at the right time. You don't want them to come out too early. Yeah, you want them to come out at the right time. And the teeth, the cavities are formed by 3 things, okay? First of all, you have to have the right environment. And the right environment is where you have a child, the conditions in the mouth allow for bacteria to thrive, okay? So this is a child who is not keeping their hygiene well. Secondly, they're eating the wrong kind of food and snacking frequently on food that has fermentable carbohydrates. And these are simple sugars mostly. So we're talking about biscuits, juices, sodas, candy, chocolate, cookies, even milk, sweetened water, okay? Because what happens is that the bacteria love fermentable carbohydrates and they feed on them. And when bacteria feeds on these carbohydrates, the byproduct of that process is usually acidic. And now, your tooth is made of a material called enamel on the outer covering, and enamel does not like acid. And acids usually will destroy the outer surface of enamel. Now, everything in moderation. I mean, when your child goes for a birthday, don't deny them the fact that, let them enjoy, but let them brush their teeth in the evening. A common question with parents is, my child has been taking antibiotics and all these syrups, and now they have problems with their teeth. The problem is really not the antibiotics. The problem is usually most of these medications have been sweetened to allow the child to be able to take them. And if you've ever looked at a cough syrup, many of them, if it dries away, it leaves sort of like a crystallized sort of thing, which is basically the sugar that's in it. So if you give your child medicine before they go to bed, and then they don't brush their teeth. At night, you remember I said that the salivary flow is reduced. The bacteria take advantage of this, and that's when you start getting cavities and problems in your teeth. So let's stick to healthy food at the most of the time. Just fruits, vegetables, I mean, the legumes and grains and food rich in calcium. Remember, your child's teeth are the permanent teeth are still being formed, okay? The ones that now will later grow and they'll carry them to adulthood are being formed. So let's encourage our children to have now this, take this healthy food, okay?